Welcome back to OpenLine, talking about medical malpractice, a huge issue. And we are happy to have with us Clint Kelly, attorney, medical malpractice attorney. A lot of calls, so we're getting several calls. Let's go back to the phones. Let's go to TT. TT on line 2. Hello.
Yeah.
Go right ahead.
Good evening.
Hi, go ahead.
Well, my story is a little bit longer. In 2014, I've been to my family doctor because I have abdominal pain, and he sent me to surgeon and to urologist. The urologist say everything he checked is fine, but the surgeon said I have a biangular hernia.
Okay.
Some pills. They give me some pills, and the pain is gone, and I don't take any action. In 2015, I do some job at work, lifting heavy object, and the pain is come back, so I have to report at work the abdominal pain. The nurse at work, she checked on me. She said, I can't see any hernia, and she sent me to the doctor. He said, he checked on me and said, yeah, you have a biangular hernia, and that they sent me to another hospital. Another doctor checked and say, yeah, you have a biangular hernia, and because they say there's pre-existing condition, I have to do my own surgery. So I've been by myself to hospital, and I find another doctor. He checked on me, and he say it's hernia. I've been operated in 2015, September 22.
Okay.
Yeah. But in meantime, I have still pain until December 24th, 2015, when I've been to emergency room, and they do colonoscopy and a CT scan, and they found like 3.5 centimeters of tumors in the colon.
Oh no, really?
Stage 4 colon cancer. And right now I'm treatment with chemo and stuff like that.
All right, let's talk about that. Thank you for sharing your story.
TT, what I'd like you to do is I want you to call my office in the morning and ask to speak to Kathy. She's my consultant nurse. The number is 615-824-3703. You see it on the screen. And tell Kathy what happened. I want you to be specific about the doctors you saw, the hospitals you went to, who made the diagnosis, and I got a good idea of what your prognosis is going to be, but it's very important you identify the actors and the dates you saw these people. What it sounds like to me, just from what TT has told me, is that he was misdiagnosed. This size of a cancerous mass could easily be the cause of the abdominal pain that he was suffering. Now, I'm not saying that's what it was, but that's certainly a potential that has to be explored. So my heart goes out to him, because stage 4 cancer is extremely difficult to treat. And so anyway, TT, do call and ask to speak to Nurse Kathy, and she'll get your information provided to me, and either I or my office staff will get back in touch with you and let you know whether we think you have a case that's worth investigating.
I guess part of what you'd be looking at is why would it be overlooked? And sometimes I just wonder if they're just moving people along, or if they don't have insurance or something like that. I mean, are those the kind of things? I mean, what do you find in cases where there's this misdiagnosis, something that should have been caught and it's not, and they've been to more than one doctor or something along those lines? What's going on?
Yeah, you know, Ben, sometimes these medical providers will focus like a laser on one thing, and they don't look outside of the box, and they all stay on the same issue, and they just assume that it's the same problem all the way through, and then all of a sudden they run into a healthcare provider who actually sits and looks at the whole picture, and then happens to run an MRI scan or perform a test, and voila, you know, there it was all the time. In medicine, they'll call it looking for horse prints when it's a zebra. So I'm not saying in this particular case that's what it is, but I do think there's merit to what you're saying, where there's an assembly line of medicine that goes on. They churn people out, and because of that, no one gets a real hard look until you get into somebody's hands who's much more conscientious, is willing to take the time to find out what the true cause is of the ailment.
All right. Thanks for that story. Let's go to Ken. Hello, Ken.
Yeah, how you doing?
Great. Go right ahead.
I've got a question. I went to a dentist back in July 25th of this year, and went in to have some. They were going to do a root canal, and they couldn't do it, and they ended up getting into my sinus canal, causing me a hole into my sinus, and I ended up having to go to another dentist and an ENT, and then I've had to have a fistula done, and then lost another tooth. Now I'm wondering, where do I go from this? I've lost work, time at work, pain and suffering. I've been on all kinds of antibiotics, and I'm still seeing doctors now for the same thing, because this was all caused by a dentist messing up.
All right, let's talk about that.
Ken, I want to know what the reason is why the dentist got into your sinuses. That's an extremely unusual complication. In fact, I don't even know if that is a complication. I don't know which tooth that he was supposed to be doing the root canal on, but that's, to me, sounds like somebody that's completely off the map. That's being in Europe and somebody, winding up in Asia. I mean, Ken, you call in the morning and ask to speak to my nurse, Kathy Farrell. You tell Kathy what happened. I'm glad you provided the date of this year. You're within the statute of limitations. I want to know the doctor that you're seeing now and what current treatment you're going to get, and what your prognosis is for this. I know you've been through some pain and suffering. Anybody goes to the dentist for something like this, I know it hurts. But I want to know more about what the explanation is for why this dentist wound up in your sinuses.
Now, all right, when you talk about medical malpractice, I don't often think about dentists. So how unusual would it be?
I'm glad you brought that up. Dental malpractice is viewed the same in the eyes of the law as medical malpractice, because they're both healthcare practitioners. So our medical malpractice laws apply to dentists. I typically steer away from dental cases because the damages are usually not as severe. Someone may need a new tooth or may need a new crown. Ken's case is a little more intriguing to me because of where this dentist wound up working, and the fact that he had to have, it sounds like, some additional surgery to close a fistula, replace a tooth. I know how painful that is. So that's why I want to look into this, because believe me, when a dentist screws up and screws up bad, it can hurt.
Yeah. All right, Ken, thanks for the call. Let's go to Larry. Hello, Larry.
Yes.
Go right ahead.
Yes, sir. Good evening, people.
Hi.
Question about a dermatologist. When I had some basal cell carcinomas one on my back and one on my ear, and he kept treating it 2 or 3 times, just burning it, and the one in my back, he finally took something that looked like a soldering gun and burned a big hole in my back, and that didn't work. And he still bills me for $40, and I had to go to my regular doctor that operated it on my back, the basal cell in my back, in his office, and took it out. And then I had to go to a plastic surgeon and get my ear fixed in the hospital. And so he still thinks that I owe him some money. Now, this man didn't do a thing for me after I went back to him 2 or 3 times before I had to get it done the other 2 ways.
Okay, let's talk about that.
If I were Larry, I'd go schedule an appointment with this dermatologist, tell him that you want a conference, and I'd sit down with the dermatologist and I'd say, I'm not going to pay you a dime for what I've been through unless you want to get sued. A lot of times the doctors will withdraw medical bills if they believe that they've committed negligence. Now, I'm just taking Larry's word. I don't know that all this is the product of negligent care, but if a doctor bills me and they've screwed me up, I'm not paying that bill. And the doctors nowadays, and also the hospitals, are trained to stop billing patients if they think that will result in the patient not suing them. And that's what I do if I'm Larry.
Based on what we talked about with tort reform and the limits and everything, what sort of repercussion does he have? Because I'm thinking this isn't going to rise to the level of a big lawsuit.
I don't either, and I don't think it's going to wind up in a lawsuit at all, but I also believe that Larry has some leverage against this dermatologist for putting him in this spot. And you know, the fact that I don't know if he and this dermatologist have even had this discussion, but typically if you have a discussion like this, the physician will stop billing the patient out of concern that they'll get sued, because to them it's just a cost of doing business. They're figuring, I would much prefer not bill $40 or $100 or even $1,000 if I know that I'm going to have to defend a lawsuit that may cost me $5, $10, $20, $50,000 or more.
Right. Okay. All right. There you go, Larry. Let's go to Phyllis. Hello, Phyllis. Phyllis, are you there? We may come back to Phyllis. Hello, Phyllis. All right. Let's talk about nurse practitioners. We talked about that at the top. You're seeing more and more issues where people are interacting with nurse practitioners as opposed to doctors. Right. What sort of issues does that bring up?
All right, let me give you an example. I've got a case right now with a patient who had spinal surgery. The spinal surgery appeared to go well. It was performed by a neurosurgeon. And after the neurosurgeon had performed the surgery and written his orders, his nurse practitioner, who's hired by his practice group to take care of basically being the eyes and ears of the neurosurgeon in the hospital, this nurse practitioner was the one who was doing rounds on the patient daily until the patient was supposed to be discharged. That didn't used to be that way. Ben, it used to be the doctor was the one who performed the rounds, the surgeon, up until discharge. But that's where the change is now. These nurse practitioners are charged with responsibility for recognizing complications and dealing with them. The problem is they don't have the experience that the surgeon has. And it's been my experience in taking depositions of these nurses, that they are hesitant to contact the surgeon out of fear that the surgeon will either ridicule them or that they will appear to be like the wolf, crying wolf. And so they try to handle it on their own. And either they don't recognize it or they treat it the wrong way. So what starts out as a campfire that can be dealt with easily turns into a forest fire when the surgeon gets involved. And when the surgeon gets involved in a situation like that, often it's too late. And in my patient's case, the patient had a bleed at the bottom of his spinal cord, a big giant blood clot. And at the time, this was causing a loss of sensation and motor function in his legs. And the nurse practitioner thought, oh, well, that's just postoperative swelling. Let's give him more pain medication and anti-inflammatories, where what the man needed was to be opened back up and have this blood clot evacuated or removed. And because of this delay in recognizing as a blood clot, my client's paralyzed from the waist down.
Oh, wow.
And these are the types of things that I'm afraid are going to happen in hospitals more and more often, as judgments that were typically reserved to medical doctors are now going to be given to nurses.
So why have we seen that shift? Why was it a few years ago it was the doctors that make the rounds, now it's often the nurse practitioner?
Well, remember I was telling you earlier, I've seen one major change since I started practicing law, which is doctors seeing more patients, greater volume, to keep their reimbursements up, to keep their income up. And in order to do that, they need more physician extenders, nurses, physician assistants, undertaking duties and responsibilities they used to take on their own. And the unfortunate byproduct of that is patients who need to see surgeons on a daily basis to make sure they're not having complications, in some cases are not. And if they're not treated properly by the nurse practitioner, tragic consequences can occur.
And this issue of, are we moving people through these surgeries now? It's amazing what they can do, but you spend so little time in a hospital. Does that concern you, or is that an offshoot of just the great technology and the advances that we've had? It's amazing to me how little time now you can spend in the hospital. Do you think that's appropriate or not? I
do. I think it is appropriate. And I think, in fact, it's probably better to get people out of the hospital, because nowadays a lot of mistakes happen in the hospital. So you want to get out of there as quick as possible. The irony in my case was the surgeon performed the surgery properly, did a fine job. It's just sometimes complications occur even when you're doing a good job. You have to recognize them. And if you're in the hospital and you've got someone who's monitoring your aftercare and they don't know what they're doing or they're not handling it properly, what good is good surgery if a complication can wind you up in the wheelchair, which is what happened with my client. So I don't think it's so much a product of not staying in the hospital long enough. It's a product of not getting care from qualified people who know what they're doing after the surgery.
All right, let's go back to Phyllis. Phyllis, are you there?
Yeah, I'm here.
Great, great. Go right ahead.
All right. Yeah, thank you for taking my call finally. It's confusing watching the TV. And anyway, I want to know about this little waiver that I signed while I was laying down waiting to get surgery on my ankle, having metal put in my ankle. Very bad accident, almost lost my foot. And they came along, these people came along, a doctor with some students, and asked me if I would like to try this new procedure called nerve block. I'd have a lot less pain after surgery if I would agree to it. And I thought, wow, that's great because I really don't like pain.
Yeah.
And they went ahead and they had it look like an ultrasound machine, and they had this, I believe it was a student, being mentored by a doctor, watched by a doctor, and they stuck this needles in, and they told me to say stop if I felt any kind of shock-like feeling. And sure enough, after about a minute or two, I did. I felt like a bzzz.
Right.
And I said stop, and they stopped, and then they just, wrapped up their stuff and left. And but I signed some kind of waiver, and I don't know if scans or not, but I have terrible, horrible, right where they did that, I have these really bad Charlie horses, like at any given time, very painful, and there's no way to get rid of it like a normal one, like standing and stretching your leg or anything. It just, there's no position I can go to get rid of it. I just have to wait it out.
All right, well, that's interesting. The waiver issue and a lot there. What do you think I should say about that?
I have a feeling I know where this happened, but in any event, she cannot be forced to waive her rights to go into court if she has been the victim of medical malpractice. That is for sure. What she signed, and I'm fairly certain of this, was a consent form to allow the treatment to occur. And they will specify in that form what the risks of this type of nerve block procedure are so that she is quote-unquote informed of the risks before she consents. I'm pretty sure that's what she's talking about. So she would have the right under Tennessee law to bring a claim against the doctor and the staff member who used the nerve block if she's got nerve damage. Sounds like that's what she's talking about. She's got some residual nerve damage. Whether that is the product of negligence, I don't have a clue. But I can tell you that this agreement could not be used against her to prevent her from getting her day in court, because that would be unenforceable under Tennessee law.
I was wondering, so you couldn't have someone sign something and say, I'm not going to sue
That's
you.
correct. It's not a waiver. It is a consent form that allows them to perform this procedure, and her having the information to give that consent, but she's not waiving any rights. Tennessee law would not uphold that.
All right, we have to take a break. A couple more calls. We'll get to your calls. Hold on the line. If you want to call in, there's the number, 615-737-7587. Take a break. And I want to hear some more of your cases. I'm fascinated by that. Take a break. Be back right after this.